Hi, I'm Dr. Ed Jacobs, founder of Impact Therapy, here with Dr. Chris Schimmel. We do workshops throughout the country on impact therapy, and we're going to show one aspect of impact therapy, which is that it's theory-driven, and the theory we're going to be using is transactional analysis, or TA. And Chris is going to role-play a client, and you're going to see that within a pretty short period of time, I'm going to be using an active approach, a multisensory approach to counseling. Transactional analysis is a theory that was founded by Eric Berne, and it's built on the principles of 3 ego states, that people have a parent, an adult, and a child ego state. So Chris is coming in, and how can I help, or what's...
My husband, he just said I needed to come see you because, well, we're just fighting a lot. And he says it's all on me and that I need to, get this in order. I need to calm myself down. But I just...
What do y'all fight about?
Well, it's mainly, I know a lot of couples fight over money or, that we don't fight over that. It's his ex-wife.
Okay.
That is... It just drives me crazy that they have so much contact, and he says I'm insecure. But, I don't think I'm insecure. I feel like there's 3 people in my marriage, and I just don't, that doesn't feel good to me. And I don't think I'm being insecure.
When you say that they have too much contact, what did you mean by that?
Well, they talk 3 times a week or on, every weekend. They just are in constant...
Are they talking as friends, or do they have children in common?
They have 3 kids together.
Okay.
Yeah.
Do y'all have kids, you and your husband?
No, not yet. We're talking about that.
So these kids are young? Pretty young?
15, 11, and 10.
Okay.
Yeah.
And they talk on the phone. Is it about the kids, or are they talking about work or friends?
He says it's mostly about the kids, and I try not to eavesdrop. Sometimes, I just can't help myself from listening, to what they're talking about, and it sounds like mostly it's about the kids, but I just don't think they should be having that much contact.
Okay.
So I will tell him, I'll say, it's not natural for you to be talking. And I feel like when he's home with me, he should be focused on me some. And we work, we each go off at, he leaves for work at 6:30, I leave for work at 7:30. We don't see each other all day long. And then we come home, have dinner, and the first thing he does is he's on the phone with her about the kids.
Let me try to show you something. There's a model in counseling called transactional analysis, or TA for short, and it talks about 3 ego states: the parent, the adult, and the child. This is you. This is Chris. What's your husband's name?
Steve.
Steve. So we got parent, adult, and child in each of you. Mm-hmm. Like right now, you and I are in I'm in my adult, you're in your adult, you're listening to me. We're having an adult-to-adult exchange.
Okay.
Does that make sense?
Sure.
Okay. When a description of a fight is when either the 2 child parts get into it, or the 2 child parts get into it, or this sort of critical parent, you aim that sort of at him. Mm-hmm. What happens when you criticize him?
Well, at first I think he tries to ignore me, and he just kind of shuts down a little bit, and he won't talk, but then he'll finally, I guess I just push him too far, and he'll say, "You are being ridiculous, and we're talking about the kids, and I have kids with this woman,"
and then he comes from his critical parent, and then y'all get going in this sort of figure 8 or infinity. And remember when I said that the 2 adults?
Those 2 aren't in the mix. Yeah.
So you want to think, how do you stop fighting with him? Now...
Well, no, I want him to stop communicating with her so much. Yeah. Is that unfair of me to ask that?
Well, that's a good question. When you say, is it unfair, like how will they communicate if they're truly just talking about the kids, and are they in sports or things going
Oh yeah,
on?
they're all real involved in stuff.
And does he take them some, and so he's
Yeah,
he's
it's
pretty
shared
involved
custody.
with them.
Yeah.
Okay, is that what they're talking about?
Well, I mean, he says it is, and it sounds like a lot most of the time they are.
Okay, let me just show you just with yourself. I'm going to use this chair here. There's this part of you and this part of you.
Mm-hmm.
And this is sort of the adult part. Let's see. I have to think, son. This is the adult or the thinking part. Mm-hmm. This is the hurt, scared part. When he's talking to his ex, do you think you're in this seat or you're in this seat?
Probably this seat.
Yeah. What's that look on your face?
Well, I mean, when you talk about it like that, I'm probably in my
child part.
Yeah, I think any woman would be a little insecure. I mean, he was married to her for
15, 20 years.
Yeah.
Not a lot of women would be. But the main thing is, if what I can do is, if you sit in this seat, then instead of the fight starting maybe from here, you saying this, or you're in this seat really hurt, and you send some message to him this way. But what we got to do is get this involved. Mm-hmm. Is he talking to her about rendezvous or meeting or?
No, I really don't believe that.
And do you believe he loved? Okay, go ahead. Sitting here, what?
Sitting here talking to you, it sounds silly because I do believe that it's 99.9% about the kids.
And the other point, but is it about any of them hooking up again? And that's what she's afraid of.
I don't think so, but I'm afraid of that. I mean, I'm afraid it could lead to that.
But you said 90. Are they having any kind of that talking? Do you know why he divorced her?
Yeah, I mean, I know the whole history. I mean,
yeah. Do you think he has an interest in getting back with her?
No, but I worry. I mean, she worries about that. That part of me
worries. What's the difference between these two?
She wouldn't worry about it, I guess.
What does this sign say?
Think.
Go ahead.
Well, how do I get out of that? I don't
know. That's what we're going to do.
Okay.
Okay. Let me talk about this as you review this clip. Because even at the first, I cut off Chris at some point, if you saw me do that. And then you saw me use different the different props in the visual image. Chris, you want to comment on?
Well, I think the one thing I would say as you watch this, I think when we're teaching it to students or doing it in a workshop, the one thing that really doesn't come through when you're just watching is the power that the chairs have, and especially the small chair. And even as I'm role-playing that and he puts the small chair out there, it really has an effect. And it really resonates with me, even in role-play. And I look at that, and I understand it, and it just makes a huge difference when you take that multisensory approach.
Impact therapy is an active, multisensory, theory-driven approach to counseling. And that's what you saw in this clip. And we can't emphasize enough how to make your counseling more visual, talk to your client's eyes as well as their ears, and make sure it's theory-driven. For more information, go to impacttherapy.com.